I think every single stage of it is equally as important. Now, there's one kind of major appointment, which is when the implant screw goes in. So that's the sort of one appointment really that classes as a sort of surgery. From the patient's point of view, the day that's most important is the day they get the tooth. And sometimes that can be, sooner. Sometimes we can place the implant and put a tooth on it fairly quickly. But other times it can actually take a few months, and that's where the planning comes in place, because if you don't have enough bone, we usually have to add some bone on top of that, and that's where we'll maybe take a 3D scan of a jaw. We'll see kind of what's available and decide from there the best kind of course of action. But for me, once the implant's in, that's key, but from then on we're deciding how the tooth's going to look, because it has to be, it's not just about being solid, but we want it to look natural, and the rest of the teeth need to be healthy. We need to plan on things like the colour, the shape, the way it bites on the other teeth as well. But yeah, every single stage is quite important. Now, on average, there are going to be a few appointments between the implant going in, checking it through, and then starting to make the tooth itself. But it's really good because we work as a team. Some of the guys will maybe make to the teeth after I place the implant. We've got a lab in-house which lets us not only plan where we're going to place the implant, but I can actually go in and speak to the technician and say, look, this is how I want the tooth to look, patient's looking for this, can we design this in a certain way? And it generally means that if we are planning treatment knowing that this is how I want it to look, we can work towards that rather than just starting, placing the implant and then sort of chasing our tails trying to decide how it looks thereafter. So a lot of it comes down now to even to the digital technology, where we can do a lot more planning than we used to. So we can take lots of photographs, we can look at your full face, how the tooth would fit into the smile. We can take a 3D scan of your mouth and your jaw, knit them together, and really from then we have a proper 3D model of essentially your head. From that we can decide where we want the implant to be, where's the best bone for that, but also where the best position for the tooth to be would be, because that's crucial. So if the implant's in good bone but it's actually not in an ideal position, the tooth won't quite look as good as it can. So that's where, again, planning at the start tends to make it kind of better results going forward.